Welcome to Focus on Health. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University, and here's our new normal for Focus on Health for the time being as we're all shut in on lockdown. I'm very happy to welcome a very important figure in our community, and that would be Lori Brewster, who is the health officer for Wicomico in Somerset County. And she has graciously taken time out of her very busy schedule to come on and talk about where we are with COVID-19 locally. So Lori, thank you so much for coming on the program. And please give us an update. I imagine you're pretty busy these days.
Well, thank you, Mary, for inviting me. Yes, we are very busy. The numbers of positive cases continue to rise as testing becomes more available. We are doing a lot of work related to monitoring these cases, the positive cases, making sure that when they're ready for release back into the community or they are at home and we can monitor their status at home when they can actually be off of home isolation. So we are extremely busy. The numbers keep going up, as is across the state of Maryland, as is across the country. So we're extremely busy.
So I imagine you're saying you're like the local repository for tracking the cases and doing appropriate follow-up for both Wicomico and Somerset, or for the entire Lower Eastern Shore? Or?
Just Wicomico and Somerset. So what happens at this point is when an individual is tested, their test results are put into a computer database, which we pull from, and if they are positive, we reach out to them to begin contact tracing.
I did want to ask you about that. We'll hold off on that for a minute, but I know a lot of our local viewers want to know about where we are with the testing piece of things, the virus testing.
So the testing is improving. The numbers of testing are increasing. In fact, we're doing some drive-through testing currently by appointment only and with a doctor's note. So we're seeing some increased testing, but there's not enough for everyone to be tested, unfortunately.
And that's kind of a major piece, isn't it? I mean, do you see that improving?
I think it's improving, but we're nowhere near where we need to be in order to open up testing to anybody that wants to be tested. So we're focusing primarily on individuals that are in long-term care settings or hospitalized or healthcare workers. There are other individuals being tested in some of the other facilities like urgent care, depending upon the level of illness that they're seeing.
I know that's one concern a lot of people have, including myself, is where are we in terms of these long-term care facilities, assisted living and such in this area, because there's obviously some major problems in that realm, you know, in other cities and so forth. I haven't heard that we're in any kind of trouble yet, but I didn't know if is that part of the health department role as well, as to keep track of those cases and specifically?
Absolutely. We are on a call with the hospital and all of the long-term care facilities in the area to look at potential cases, what their bed capacity is for people being discharged from the hospital, as well as any individuals that need to be on observation. So when an individual goes into a nursing home now, they are put on a 14-day observation status so that we can make sure that they are COVID-free. So we are meeting virtually with all of them to look at what their needs are, if there are needs, and the health department is supplying many of them with the protective equipment that's needed in order to work with these individuals.
Oh, very good. Do you want to talk a little bit more now about this contact tracing? That seems to be the new buzzword now as part of when being an important key on when we're going to be able to open back up, so to speak.
Absolutely. So when we get notified that there is an individual that is a positive test result for COVID, we meet with that individual and or their family member if they cannot speak because they may be on a ventilator, to determine where they've been in the last 14 days and what close contacts that they've had with individuals, either family members or friends or within their work environment, so that we can provide them with instruction to either home quarantine, wear a mask if they are exposed, monitor themselves for symptoms. So as you can imagine, people now can tell you where they've been in the last 14 days because they should have only been home and to the grocery store or work. But before that, just can you imagine even saying where you have been in the last 14 days? That would have been a difficult task. But, for the average individual, we're seeing, anywhere from 2 to 20 individuals that they've had close contact with. So we're monitoring them for symptoms moving forward for those 14 days.
Maybe remind us, just to reiterate, how long can you be contagious, or, what the typical symptoms are?
Well, that changes continuously, but right now you can actually spread the virus from 2 to 14 days from the date that you have contracted it. We know that there are individuals that are asymptomatic throughout, so they're carriers of the virus. When individuals become sick, what we're seeing, which is most concerning, is the severe shortness of breath that they are having, which results in hospitalization and being put on oxygen and potentially on a ventilator. We've had people that haven't had a fever, but fever is one of the other concerns, and an intense chronic cough. Even after people are discharged from the hospital, they have a severe cough.
I'm also hearing people are having a loss of taste and smell. That can be an indicator.
And one of the new ones was an individual that had hiccups that would not go away. So that was an oddity. But I think this virus is so new that we are learning as the virus progresses.
Yeah, I know it's quite a challenge.
Absolutely.
I know everyone's just anxious for scientists to make progress in terms of either a medication treatment or, of course, a vaccine. That'll be a bit down the road. We wouldn't be good nurses if we didn't do our due diligence in discussing what people should do if they believe they have symptoms, or what they can do to prevent from possibly getting COVID-19.
So if somebody's concerned that they may have been exposed or they're having some mild symptoms, they need to self-isolate at home, stay in one room in the house to avoid contact with others, not be in close contact with other household members. So what I tell people is to, go into a bedroom by themselves and only come out to use the facilities, and make sure no one else is around when they come out. If they are having severe difficulty breathing, of course, they need to go to the emergency department, but I encourage people to call their primary care office and discuss with their primary care physician or primary care provider. And if the answer is still to go to the emergency department, to go, and they have procedures in place to protect other individuals from being in contact with the process. Otherwise, there is the masking when out in pharmacies and retail space and grocery stores now, as well as washing your hands. I mean, that is the one best procedure you can do to avoid from getting COVID. And stay 6 feet away from people, even when you are masked. That way, we think that social distancing of the 6 feet has a significant impact on mitigation of the virus.
Right. The goal is to flatten that curve. We keep hearing that as well. And I think this is all
Absolutely.
just very good advice. Are you in contact with PRMC at all, or I assume you are, in terms of where they are in their role in this whole COVID-19
Daily.
crisis?
Sometimes more than daily, multiple times during the day. They have done a significant work with expanding their bed capacity, particularly with their intensive care unit, and expansion of ventilators, so that they can address the surge in need for hospital beds. So they have done a lot of work in preparation for this virus and should be commended for that.
And I know the community's really come together too, as far as, thanking our nurses and doctors and all our healthcare professionals, including you. You're working very hard during this time, and I think we take that for granted, but it has been inspiring to see how the community has come together to donate supplies and various other things to help us get through this.
Absolutely. And someone asked me not too recently, what is it about this pandemic that the health department is handling? And I said, well, this is what public health does. This is public health. So, I think it's bringing public health to the forefront of managing this pandemic.
Exactly. Well, it's a time for public health to rise to the top. Not that you're not always there, but people are definitely seeing the role of the health department and public health nursing, and all those facets that have to come together to help us coordinate this so that we can flatten the curve and hopefully move on. I know I speak for everyone that's just ready for this to be over, but it's best not to let down our guard too soon, correct?
Absolutely. If we stop doing these protective measures too soon, we could see a significant surge in need for hospital beds, and significant deaths occurring. And that's what we want to prevent at this point.
Exactly. Well, thank you so much, Lori, for taking time out of your schedule to be with us and inform us about where we are in the community and so forth. And thanks for all the work that you're doing, as well as the health department.
Well,
And
thank you for inviting me.
We'll post your information at the end of the program too, the website, because you do have a website with a lot of information available for people.
Absolutely. We have a daily update on the numbers of cases in Maryland as well as in the counties.
I know the state of Maryland also has a similar website. So there's information there for people that really want to keep close track of it in between washing your hands and getting masks ready and those kind of things. So
we also have information in other languages as well. So I would encourage people to look at that.
Okay. Well, thanks again, Lori. I really appreciate it. And stay safe and well.
Well, thank you. You as well.
And thank you for joining us for this edition of Focus on Health here on PAC 14.